Coming up today, the brutal cold is more than just uncomfortable. It can be dangerous in many cases. Today, we outline the effects temperature can have on your body, and we share tips to keep you out of the emergency department. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. We see it all in these Midwest winters: snow, ice, sub-zero temperatures. Today, we have gathered some great expert doctors to discuss the biggest things to keep in mind while the winter weather affects our health. All right, let me introduce them. We've got all the way across the table Dr. Travis Love. He is a cardiologist here to explain how the cold and winter activities can affect the heart. We've got in the middle Dr. Dhaval Bhavsar. He is a plastic surgeon and the co-director of the Burnett Burn Center, and here to talk about frostbite injuries as well, which are surprisingly similar to burns, as we know. Dr. Kallida Rich is a geriatric medicine specialist helping us to keep our older population safe. Good to have you. And Dr. Brian Beaver is an emergency medicine physician who sees folks coming in and out of the emergency department all the time. How are you today?
Great.
All right, good to have all of you. A ton of expertise sitting right here with us. So let's get started. Dr. Beaver, let's start with you. So what are the main issues that you see in particular in the emergency department when the temperatures start to drop and when we see those really frigid temperatures?
Absolutely. When we start getting those really frigid temperatures, that's when we start getting the patients that come in hypothermia with their body temperature far too cold and have to treat. We start seeing frostbite and frost snip. And then we see things you might not think about with cold exposure, things like carbon monoxide exposure from when the power goes out and someone's trying to run a heater inside the house or a generator in the house. And then we also start seeing a lot of burns, whether it's burning bonfires or fires started inside from trying to stay warm.
So when we think of cold weather exposure, how long does somebody have to be outside before it starts to become dangerous?
Yeah, it really can vary. A lot of it depends on the temperature. It depends on how they're dressed as well and what sort of clothing, as well as do they become wet. If they're wet and they're outside and it's cold, it's going to be much faster. You're going to have a lot less time to spend outside in the cold that way.
So let's bring in Dr. Bhavsar. How quickly does frostbite happen?
It can be as little as about 15 to 20 minutes and as much as about 30 minutes when the temperatures are below, say, 20 degrees or 10 degrees, which is very common for us in our area. So if you're working outdoors, doing stuff, cleaning or clearing ice, and you're there for 15 minutes, 20 minutes, I think it can be enough to cause frostbite. And you have to make sure that you're protecting yourself, and if temperature is any lower and you're spending time in 30 minutes and kind of longer, your skin is not protected, very, very high chance that you will at least get some amount of cold injury.
As adults, we often know some of those things. Whether we, listen is one thing, but let's talk about our kids.
Yes.
Let's talk about what parents should know with kids, because they don't always know how to regulate their body temperature and how to keep it warm.
So if your kids are going to be playing outside in snow, going for sliding, and make sure they're well protected, they're layered up, their skin is not exposed, and if it's going to be a very cold, like wintry, kind of blistery day, make sure they stay covered, they're not outdoors for too long, and their face is covered as much as possible. It's very common for us to see the kids with a kind of that red nose becoming that little bit of frostbite on the tip of the nose.
Well, so what are some of the first signs, especially with the hands? They come in, they take off those wet, those wet gloves that they have, those little tiny tight gloves, and their hands are bright red.
Yeah.
What do you do? Do you put them under water? Do you just let them kind of thaw out?
Right. So I think active rewarming is the best way of achieving that. So the kind of running tap water, a little bit warm side would be good. We don't want it to be super hot and cause reverse burn injury later on, because it's going to be very tingly sensation, which kids or even adults would not be able to differentiate. So we want to be sure that it's warm running water, or in the sink, kind of like having the warm water in and just soaking the kind of hand in, or feet in this case, like if it's both. Also, be careful if there are adults who have neuropathy from different diseases like diabetes. Make sure you're not putting your kind of hands or feet in very warm water for a very long time, because it can cause, again, the injury from the heat or the burn. But at the same time, these are the same patients who can have a really bad kind of cold injury also, because they do not have the normal sensation.
Good tips.
Yeah, and the first thing that kids will know is, besides the color change, it will be they start having that tingly sensation on the fingers or the toes. that's a good enough time of exposure. That should be the first sign that it's enough exposure.
All right, so how common are fire-related burns during the cold winter months?
Okay. I think Dr. Beaver kind of mentioned that when it gets cold, and if there's for various reasons people have to do indoor kind of heat, whether it's from fire and then just lighting the kind of either the gas fire, log fire, and the carbon monoxide poisoning, to using space heater and then having space heater too close to the person, directly catching fire on the blankets or the skin itself or the clothing, or patients with altered sensation staying too close to the heat and then causing burn to that exposed parts of the skin.
And Dr. Beaver, you already saw some of those kind of early on, in kind of in the start of the fall even.
Yeah, we've already had a couple of space heater burns related that are on the burn unit now, and then we've also had the bonfires. Please don't use gasoline on a bonfire. It does not go well, and so we've already had some of those as well this year.
Well, we think it'd be common sense, but thank you for the reminder for those who needed it. Dr. Love, can cold weather trigger a heart attack? Is that truth or myth?
Yeah, that's a really good question. I think it's something that the public often thinks about is people having heart attack while shoveling snow. I don't think that cold weather directly causes heart attacks, but oftentimes for people this is their one moment of exertion for the year. They may not mow their own lawn, they may have somebody else do that, they get some snow on the stoop, they go out to shovel, and that amount of exertion can reveal underlying coronary artery disease or blockages in the heart arteries. So sometimes we will see people come in with chest pain or heart attack-like symptoms as a result of shoveling snow and being out in that cold weather.
Yeah, just that surge of energy. So
Yeah.
how could you lower the risk of that?
Yeah, I think knowing exactly what your exertional threshold is and not having this be the only time of year that you're, doing that sort of exertion. So, being prepared for that, regularly exercising so that when it's time to shovel snow, your body can handle it. You got to remember when you're cold, your body's trying to provide heat and blood flow diverts to other areas of the body to stay warm. And when that happens, areas of the heart that need the blood, if you have a blocked heart artery, aren't getting it. And so you have to be prepared for that.
So what would be some early warning signs that you've overtaxed your heart? Is there something people should be looking for, or a loved one when you come back inside?
Yeah.
Maybe should they be looking for some signs?
Yeah, and it can be very tough in cold weather, but chest discomfort, chest pressure sensation, arm discomfort, jaw discomfort, back discomfort, upper back discomfort, shortness of breath. The problem is a lot of these things can happen while just shoveling snow. We've all been out there in cold weather, we get short of breath with that. So it's important to take that seriously, and if you're continuing to have shortness of breath that's not getting better, chest pressure, arm pressure that's not getting better, you should really seek medical attention.
Dr. Beaver, do you see that often?
Oh, absolutely. Yeah, we'll see people that it brings out their angina or their chest pain just because, like Dr. Love said, they're overexerting themselves from what they're used to, and their body's having to increase their metabolism to keep up with everything else that they're trying to do out in the
They're
cold.
out there trying to be the hero, right? Dr. Calendar Rich, let's bring you in here because it's estimated that 1 million people slip and fall each and every year here in the country. That can be very dangerous. We know for our older population. I know this is something you're very passionate about. So let's talk about that and how we can keep people safe. What should we know?
I mean, first of all, I think that many times we sort of imagine that the ground is slippery, we know it's slippery, we need to help our loved ones walk on the ice and snow, and not everybody has someone who can help them, right? And so really just making sure that people who need help to get out, that have to get out, have that support, and then walking next to them, making sure that we're all safe, wearing the right shoes can be really important, and just being smart about what we're doing.
Being smart. Not always easy, though. We want to get out there and do what we got to do. It's hard to slow down in those winter months when the weather hits.
Especially when I'm always telling people to get out and move, right? Movement is medicine, but stay home.
Exactly, but stay inside. And I mean, those can cause some issues for people down the road, and for any age group, but for our older population, this could be long-term issues.
Right, so we know that people that fall, first of all, are at higher risk of future falls, and we know that our bones change as we age. They get thinner, they get more frail, and so, fall risk is not only about can I get back up, which is a big deal, it's also about did I break anything, and then can I recover? How am I going to recover? How am I going to even recover from a small fall with bumps and bruises? Because we all know that the less you move as we age, the less you move as we age. So really regaining that strength and getting back to normal is really important to prevent future falls and future incidents.
What else keeps you up at night when it comes to our aging population during these cold winter months?
So many things.
I know. Share with us right now.
I mean, I think it's many of the things that
Yeah.
we've discussed, right? Like ensuring that people have heat, that they have the support that they need, that they have someone who can run to the pharmacy and get their medication so that they don't go out, so that they have a ride to dialysis. This is a really big deal, especially for people that perhaps don't drive themselves or don't want to drive in that icy, cold, snowy weather, right? And so it's just sort of really important to reach out to your neighbors and your friends and your family and make sure that they have the things that they need so that they can be the most successful.
Dr. Beaver, let's talk about car accidents this time of year. What are you seeing?
Yeah, so once it gets icy, of course, the number of car accidents starts going way up. And so big things to do to try to keep yourself safe is, number one, if the weather's bad or it's going to be bad, prepare ahead. Try to have things, the food and stuff at home so that you don't have to go out unless you absolutely have to. If you do have to go out, make sure that you are aware of the capabilities of your vehicle. One of the big myths is that while the four-wheel drive car will help you get through the snow easier, those four wheels slide just as well as a two-wheel drive. And so it's very common for us to see people that think that because their vehicle's a four-wheel drive and they don't have a problem driving, the problem is not the driving, it's the stopping. And so make sure you understand the capabilities of your vehicle.
Yeah, just ask yourself some simple questions. So we're going to try to help you and your folks out there in the emergency department is because how do we know when to come? You know, we never want to turn anyone away, but it does help
Absolutely.
because then people need to come, then they got to get out in the weather again. So how do we find that balance? Who really needs to be in your department?
Yeah, absolutely. Anytime, obviously, we're open 24 hours a day, every day of the year, never close, and we are happy to take care of anyone at any time that they feel like they need to be evaluated in the emergency department. Oftentimes, you know, if you can use resources like your primary physician to call first and find, you know, talk to them about your symptoms, get some additional input to see if this is something that you need to come in. If you're a heart patient, give the cardiologist, your cardiologist, a call and let them know what your symptoms are, and then see what our options are for if you need to come in and get evaluated in the emergency
Yeah,
department.
but don't wait when it comes to your heart, right?
Absolutely.
Get right in there.
Don't wait.
Absolutely.
Yep.
So what about carbon monoxide during this time of year? Who wants to tackle that?
Yeah, so we start seeing carbon monoxide go up. Most of the carbon monoxide that goes up is from either people that are warming up their cars in their garage with the door closed, we see commonly. And then we also see when people start to, when we have the power outages and people start bringing generators inside and running a generator inside to try to keep their appliances, et cetera, going. That's really when we see the carbon monoxide start going up.
Yeah, is that a concern for you, Dr. Callender?
And I
Rich?
think it's probably a concern for all
Right,
of us.
yes.
For sure.
Yeah.
But I will say for our older adults, it can be particularly life-threatening.
Dr. Bhavsar, what keeps you up at night? When it comes to this, anyway.
Right. So no, it's very fair. Every time we have this big dips in the temperature and a kind of prolonged time, and especially around the holiday time when and people are going to be kind of gathering, enjoying, partying, and then also drinking. That's when we see our numbers for the frostbite go up kind of exponentially. So every time that kind of combines the time for enjoying and partying with that cold weather, we do see significant increase in our kind of frostbite injuries. And we in fact prepare, we communicate with our kind of teams that we work with around the hospital in anticipation and hope that we don't have to, but then we kind of prepare our teams and other teams to make sure that we have we are ready for that increased number that we know we will get. I hope people see this and make sure that they can prevent, like burn we talk about, preventing burn, and we have been generally very successful. Same thing, we want to kind of decrease the chances of frostbite for our kind of population.
Good tip, bringing up the alcohol factor. I don't think we always think about that, especially during the holidays. Dr. Love, what concerns you about people being inactive during this time of year? I mean, we want to stay heart healthy. We talk about that. It never stops. But what advice do you have for people trying to keep their heart healthy and strong?
Yeah, so inactivity is a big problem during these winter months. It's cold, it's hard to get outside and walk. It's important to still try and do that, whether it's at a local gym or going to the mall or Walmart or a grocery store and walking and getting steps in and trying to stay as active is possible. I think another thing that really concerns me during these bad weather months are people having symptoms and not seeking medical attention because they're concerned to drive, or they don't want to bother a family member to come and help them, and they may be having chest pain or heart failure symptoms or something like that, and they're not seeking the medical attention they should. So just because the weather's bad doesn't mean they shouldn't be coming in and having these symptoms evaluated.
I want to get our takeaways today. Dr. Love, I will start with you. What's the biggest takeaway from your standpoint as a cardiologist you want folks to know?
Yeah, so when it comes to cold weather, and especially I think when we talk about coronary artery disease, blockages in the heart arteries, when we're going to go out and shovel snow, just be prepared for what that entails. Make sure that you are capable of doing that. If you're not, ask a family member, a friend, a neighborhood kid to help you out with shoveling. Don't put yourself in a situation where you're doing more physical exertion than you're used to, and putting yourself at risk for developing something like a heart attack or a blockage in a heart artery.
Dr. Beaver, what's the takeaway?
Yeah, so I think when the weather does get bad, obviously try to be prepared as much as you can. Make sure that when you're going out that you're wearing the appropriate clothing. If you need to run a generator, run it outside. Be prepared with those things, but then also, piggybacking on what Dr. Love said, if you're having symptoms of something and you're worried about getting to the emergency department, our ambulances operate every day of the year, all the time, no matter the weather. So you can always call 911 in the worst of weather. If you're afraid to get out and drive, you're having chest pain, call 911. We'll come pick you up.
We'll put it on your shoulders.
Yeah.
We like it. All right, Dr. Bonsar, what's the takeaway today?
Yes, try to be safe. If it's that cold that that your skin feels it, try to minimize the time outside. Make sure you layer up. Minimize the exposure to the skin. And if you see the changes in skin, like really red skin, eventually reach out to us. Our Burn Connect Clinic is always available to answer your questions.
JKR, wrap us up. What's the takeaway?
I think my takeaway is to listen to your body, right? Know where you are, know what you can do, know what makes sense. Use your head, your heart, and your whole body when you're making decisions.
Great tips, great advice. Guys, thank you so much. Appreciate it. All right, thanks to our viewers today. We'll see you next time.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now, everywhere podcasts are available.